Hello everyone, I am Sydney, a blogger from My Fat Pocket. So most people who know me now would never believe that I was fat once. I was 10 kgs heavier 3 years ago. So even though I've shed those pounds, I still have some loose skin on my thighs which I wanted to tighten. That's when I asked Dr. Terence Tan from Halley Medical Aesthetics for help. So after talking to him, I realized there are so many options available to weight loss, fat reduction and skin tightening. And this ranges from fat freezing liposuction to high intensity focused ultrasound or HIFU. So in fact, laser can be used to firm and tighten sagging body skin. And this is the treatment Dr. Tan did for me. So how do we decide what is the best treatment for our body? Let's talk to Dr. Tan, shall we? Hello Dr. Tan, it's nice to see you again.
Hi everyone. Hi Sydney, thanks for having me. I understand you have some questions for me.
Dr. Tan, a lot of people are very concerned about their weight, and so we exercise and we watch our diet. But no matter what we do, we just can't seem to get rid of the stubborn fats around our tummy. So what should we do?
That's a very good question. Actually, weight loss and weight reduction are two very separate things. But there's a very common misconception. Weight loss just results in a reduction of weight, whereas fat reduction results in loss of fat over a specific body part, and that results in body contouring.
You mean weight loss and fat reduction are not the same?
It is not the same, although a lot of people think it's the same. So please let me explain. When we lose weight, if you have a look at these two pictures, we merely we have actually the same amount of fat cells before and after we lose weight. Only the fat cells become bigger and smaller with weight gain and weight loss. So the actual number of fat cells actually remain the same, whether we are a little bit heavier or we are a little bit less heavy. Now, also a lot of people ask me about exercise. A lot of people do plenty of sit-ups thinking that their tummy will get nice and shapely. Well, yes. Yes, for one, the tummy will get a little bit more toned, the muscle becomes a little bit more firm, but there's no such thing as spot reduction of fat. The scientists have done numerous studies and found that just because you exercise over one part of your body does not necessarily mean, in fact, it doesn't reduce the fat over the area of exercise. So, loss of weight and exercise is the same. So let's say if you have troublesome bulges like over the tummy, with weight loss, your body contour remains exactly the same. The problem areas, like the bulge of your tummy, will remain. And that's where fat reduction comes in very useful. So there are various methods of reducing fat, and there are various machines that can do so non-invasively. And probably the most popular machine at the moment is the Zeltic CoolSculpt. So it reduces fat through cryolipolysis, or what we commonly known as fat freezing. And it's a really good product. Yeah. We also have various other methods, but all in all, when we reduce fat, what happens is that we physically reduce the number of cells within our body. Now, just like the other diagram we saw over here, in this diagram, you physically see that with fat reduction methods, the number of fat cells actually decrease because fat cells are destroyed. However, the fat cells, the size of the fat cells remain the same. So when this happens over your problem areas, you actually have less fat, and therefore you change the body contour. So that's the answer to your question. Fat reduction and weight loss are two different things, but they do work really well together. Weight loss generally reduces your weight, gives you a smaller version of your old self, but fat reduction achieves body contouring, and body contouring is useful to give you the curves that you really want.
Many people say that with the exception of liposuction, other fat reduction treatments do not work as well. Is that true? But what if I do not want an invasive treatment? Liposuction looks very scary and painful.
That's a very good question. Yes, I mean, obviously, surgical methods like liposuction is probably the most effective way to contour the body, but not everybody really wants to go for surgery, and definitely not everybody can afford to have downtime after liposuction. So that's where non-invasive fat reduction methods come in. Now, there are various machines out there in the market right now which are very popular, and some of them are actually really effective. Of which I think the most popular method of fat reduction right now is cryolipolysis, or what a lot of people call fat freezing. And the only FDA approved non-surgical fat reduction method through cryolipolysis is actually the Zeltic Cool-Sculpt. So what Zeltic does, it achieves fat reduction through cryolipolysis, or what a lot of us laymen know as fat freezing. So the scientists at Zeltic have found that when you subject fat to a magical low temperature for a fixed duration of time, the fat cells actually crystallize and they will die. But the other tissues will survive. So the skin, the muscle, well, the bone, the blood vessels, the connective tissue, and even the nerves, they are completely unaffected. And that's great because what Zeltic does is that it freezes that fat for body contouring without damaging the other structures. So that's really good for body contouring. So what actually happens is that the patient lies down comfortably on bed, and we place applicators over the problematic areas for fat reduction. So various areas can be done. I mean, the most popular will probably be our tummy. So our tummy can be done with applicators applied. The next most popular probably would be the love handles or the muffin tops behind. And other places can also be done, like the underarms, for the ladies, the bra fat behind, the inner thighs, the outer thighs, or the hips, and even for men, you can even have fat reduction around the chest. Some men are just really embarrassed about excessive fat over the chest. And there is also the new applicator which has just come in. It's called the Zeltic Cool Mini, and I'm really excited about that. And with the Zeltic Cool Mini, we can even address and treat a double chin, fat over the submental area, or this area just behind the chin and in front of the Adam's apple. We can treat fat in front of the armpit, behind the armpit, and even for problematic fat just above the knee. So we are really excited about that.